Good evening, everyone, to our monthly installment of Compass Academy. I'm Dave Seeger, Director of NJ4S, Ocean County, a preferred behavioral health group. Just going to give a quick overview for anybody that may be joining us for the first time and give you a little bit of history on NJ4S and preferred behavioral health and let you know what we have, um, who's going to be joining us this evening. So, preferred behavioral health, I'm sure if you're local to Ocean or Monmouth County, are familiar with our agency. We've been around since 1977, serving children and families and adults across the spectrum regarding mental health, substance abuse, school-based programming, prevention services. This particular initiative is part of the statewide Student Support Services, otherwise known as NJ4S. It was released last spring by the Department of Children and Families to provide efficient access to safe spaces and build connections for prevention of mental health resources to families and youth grades K through 12. Locally, people over the past year have come to know us as Compass. It's under the NJ4S initiative of Department of Children and Families, but locally we're known as Compass in Ocean and Monmouth County under the umbrella of Preferred Behavioral Health Group. Our services include a tiered system approach to youth grades K through 12 and adults in the areas of suicide prevention, bullying prevention, substance use prevention, and teen pregnancy prevention, sexual health prevention, in a tier 3 system. So it goes from anywhere from a class presentation to a large assembly, to a library presentation, to a professional development day, into a small group setting, which is maybe targeted interventions for youth that are identified with a specific need. And then our tier 3 interventions are individual-based mental health assessment, screening, referral, and counseling. So our services are primarily done in the school setting during the school day, referrals made by school staff. However, if you are a community-based provider or you run a summer camp or a youth program through your church or recreation center, you also can access our service, our tier 1 services, which is when we can come out and do some of our prevention programming. One of the things we're excited to promote this year to our all children ages 13 through adult, whether you be a parent, whether you be a teacher, educator, professional, or just a resident of Ocean or Monmouth County, we're offering a free online platform called Tau Connect, stands for Therapy Assisted Online. And this isn't like virtual therapy. This is a self-help platform you can download and get free access to learning modules related to mental health, mindfulness, stress reduction. And you can access this by going to our website, preferredbehavioral.org/tau-connect. So we really encourage everyone to take a look at that. It's a really free and accessible service that we're offering for participating in Compass Academy tonight. Here's our remaining series Compass Academy webinar. We do them monthly. Our last one for the school year will be coming up May 29th, Mental Health Awareness Month for co-occurring disorders. But if you have an interest in reviewing some of the previous webinars that we've offered throughout the school year, you can visit our website, preferredbehavioral.org/compass events, and you will find a full listing of our library of previous recordings. So I am going to give you an introduction to our speakers. We are always honored to have them with us, join us every month, real experts in the field of prevention science, and have really built us a great library of exceptional content and data-driven presentations throughout the whole school year, and hopefully trainings for us staff and professional adults throughout the summer months as well. Partnership to End Addiction is a national nonprofit organization based in New York City. Partnership's mission is to transform how our nation addresses addiction by empowering families, advancing effective care, shaping public policy, and changing culture. Dr. Linda Richter is the Senior Vice President of Prevention Research and Analysis at Partnership to End Addiction. where she conducts research on the nature, scope, predictors, and consequences of all forms of substance use and addiction, especially among young people. Corey Hammond joins the team as the Director of Prevention Services. Partnerships Prevention Team leverages research to help raise awareness among parents, educators, health professionals, and policymakers about best practices in substance use prevention and addiction care. So I'm going to turn the screen over to them this evening, and everyone is in mute mode. So if you do have questions, please, we encourage you to put them into the chat. And if we have time at the end of the presentation, we would love to have some engaging conversation about what you'll hear tonight.
Dave, as Corey's loading the presentation, I see Shaza has wanted to say something. I'm not sure if that was on purpose. She has her hand raised.
There you go. Hi, Shaza.
Maybe an accident.
Yeah, Shaza is still muted, so perhaps that was by accident.
All right. Well, then I will get started. Thank you.
You're welcome.
I appreciate it. Welcome, everybody. We're so glad to have you here. You may be wondering, why is an organization that's interested in substance use and addiction talking to you about loneliness and social isolation? Well, it's a really important topic for our nation and actually globally right now. It's of such great concern that the Surgeon General of the United States has made it a public health priority and released an advisory about it, declaring that it threatens the health of Americans. We know that the director of the National Institute on Drug Abuse has declared loneliness as one of the key factors that is driving many of the substance use related ills that we see now, as well as a lot of the mental health concerns that our nation is grappling with. So it is very much tied to the things that we care a lot about, which is young people's mental health, their risks for substance use, and ways that we can help them to grow and develop in a healthy way. The United Kingdom and the US have both elevated this topic of social isolation and loneliness. They've appointed people in senior positions to kind of research it and find solutions. So it's of tremendous concern, not just when it comes to young people, when it comes to people of all ages, but we're going to try and keep the focus primarily on young people because that's our concern. That's our concern for now. So I just want to, you can go to the next slide, Corey. I know Dave gave us a super nice introduction, so I'm not going to belabor it, but this is our group. If you haven't met us before, who work primarily on NJ4S related projects, as me, Corey, and our terrific research assistant, Olivia Root, who helps us with these presentations. So what I'd like to talk about to get started is what we're going to cover. And essentially, we would like to talk with you about, what is social connection? So that's the positive side of the opposite side of the coin. What are some of the risks and consequences of social isolation and loneliness? What are some of the warning signs and things that families can look out for, and ways that they can intervene if they're concerned about a young person? What we could do both on the family side and also in the educator, teacher, et cetera, side to kind of reduce the risk. And then we'll hopefully have some time for questions and provide some resources, et cetera. So you can go to the next slide. So let's start out with the positive side of it, which is social connection, which is sort of the opposite in many ways of social isolation and loneliness. So speaking of the US Surgeon General, he defines social connection as encompassing the interactions and the relationships and the roles and the sense of connection that individuals, communities, and society may experience. And we know that the level of social connection that someone has isn't solely determined by how many friends they have or how many people there are around them, but it's really about the quality of the relationship. And if you think about it, there's really three main components of social connection that are important to consider. So the first is the structure. It is the number of relationships that people have. It's the variety of those relationships. So if all your connections are just within the family or just within work, it's not as full in terms of feeling socially connected as if you have connections in various spheres of your life. It also has to do with the frequency of the interactions you have with the people around you. Important also is the function that those people have in your life, the degree to which other people could be relied upon for your particular needs. So it's not just having bodies around you, but having this relationship where you can rely on them and they bring something positive to your life. And then there's the quality of the relationships. Obviously, all of these are related, but it's the degree to which the relationships and the interactions you have with others are positive, are helpful, are mostly satisfying as opposed to negative, unhelpful, and unsatisfying. And obviously, we all know every relationship we have has a mixture of good and bad. But what you're looking for is, on balance, are these relationships positive, satisfying, and helpful? And those are the people who feel more socially connected, those who have that. So this is an image from, we didn't create this, but I just kind of want you to take a look at it and think, does this look familiar a little? If you look at the categories that determine social connection, they're very similar to things we've talked about in other presentations when it comes to the public health model, or how we think about risk and protection for a whole variety of issues that we're concerned about when it comes to youth development. So it's never one thing that determines if a young person is going to be at risk for some outcome we don't want, or is going to be at risk for loneliness in this case. It's really, a mixture of a whole bunch of factors that are within their life. And these are things that, come from the individual, him or herself, the relationships that they have, the community that they're in, and the broader society. Does society as a whole make us more kind of lonely and individualistic and on our own, or does it foster connection? Are the relationships healthy in that sense? Is our community one that fosters connection? So these are all important components of determining how connected somebody feels. And because those are all the determinants, they're also all the opportunities that we have to increase and enhance people's social connection in our society. So the reason we care so much about this is because social connection is so important for both mental health and physical health. And in recent years, there's been a lot more research on this to really show just how important it is, how vital social connection and social relationships are to somebody's health throughout their life, how long they're going to live, whether that life is going to be full, or whether it's going to be, even when it comes to physical illness, it's just such a critical component of people's lives. So we know that social connection affects people's biology, literally from day one. We know that babies who are isolated and not engaged with and not connected well, they have many adverse or negative outcomes when it comes to their physical and mental health. And that's true throughout a young person's development, well into someone's adulthood, and certainly as they get into their older years. A lack of social connection really influences many health outcomes. It can have effects on the health of your heart, your cardiovascular system, your hormones, your immunity from disease and illness. All sorts of things that we care a lot about have been connected to whether someone has good social relations and connections. It affects your psychology as well. We know that it could provide an important sense of meaning and purpose if you know that others around you rely on you and that you feel connected to them and that you have people that you can rely on. We know that adults who prioritize their social relationships, especially with their family and friends, as a core, source of their meaning and purpose and motivation in their life, tend to be healthier, both physically and mentally. We know that social connection actually is really important for the behaviors that we have. So if people who are very socially connected and have good relationships, they tend to have better diet, better exercise, they adhere to their medications that they're supposed to take better. All of that affects people's well-being and lifespan. And this could be, direct effects where the people around you are encouraging you to engage in your healthy habits, or it could be indirect from seeing a lot of people around you who are doing healthier things, and then you kind of feel connected to them and want to be similar and do similar healthy behaviors. And we know that people who are more likely to adopt healthy habits like exercising or not smoking, those are ones who see similar healthy behaviors in their social circles. So the people around us really have a tremendous influence on the behaviors we choose to engage in and ultimately on our health. So here you see that having high quality, close relationships, feeling connected to people in one's life are associated in many studies with a real decrease in all forms of morbidity. That means illnesses and sickness, and a whole wide range of disease. So it is really a critical factor in people's health and well-being. And then the reverse is true as well. We know that loneliness or lack of social connection has been found to be as dangerous or as smoking up to 15 cigarettes a day. It's more dangerous than drinking alcohol daily, not having physical activity, obesity, air pollution. So it is really like not something that comes to mind when you think of the things in our environment that can make us sick or our behaviors that can make us sick, but it actually is one of the leading causes of unhealthiness is if you're socially isolated and lonely. So I keep saying social isolation and loneliness, but I do want to differentiate between the two because they're not exactly the same thing. When we talk about loneliness, it's kind of more subjective. It's our perception of our social isolation. So it's a feeling of not having the social contacts that we would like to have in our life. Social isolation is typically talked about in more of an objective way. It's lacking access to friendships or other people or communities or peer groups that can offer support and connection. So you might be someone who is not socially isolated, who is surrounded by lots of people, but yet you still feel lonely. It is your own feeling, your own perception. And that's true for, as we're going to see with a lot of young people. So often adults don't quite appreciate just how lonely younger people could feel because they just kind of think of them as like, well, you're surrounded by kids your age. When else in our life are we surrounded by so many people who are exactly our age and in the same circumstances as us? When you go to work, it's not necessarily the case. Many of us work from home nowadays a lot. School, kids, that's when you're around a million people your age. So that's true. They're not socially isolated, but that doesn't mean that they're not lonely because it is the perception of having those connections that's so critical for someone's mental health and physical health. And I just want to stay on that point for a minute because, again, it's so very important, especially when we're trying to understand kids' feelings and making sure that we're addressing their needs. We often see that kids, even who have a close, what seem like a lot of friends around them, so not just people in their class, but they're actually friend groups, they still can often feel lonely. We also know that there are many kids who, don't feel lonely, even when they don't have many people around them, like they feel fine. So again, it's very much an individual need and different people are different on the spectrum. And it is a continuum of how lonely someone might feel. We talk about it, casually as like some people are loners, some people are extroverts, some people are introverts. Some people are perfectly satisfied with just having one or two good friends, and that's all that they need, whereas others need to always have people around them. But these are different, kind of qualities that don't always go along with each other. So again, it's really important to not just decide, oh, well, this child has a lot of kids that they hang out with or a lot of people around them, they can't be feeling lonely. Because again, if you remember, the loneliness feeling is the sense of being able to rely on someone, feeling like someone cares about you, feeling like you are connected, not just the physical presence of other people. We also know that young people who are lonely tend to feel more critical of themselves and of others. And, they kind of expect rejection from other people, which can make them avoid social situations. So it could be kind of a cycle. So if a child is feeling lonely, it's typically for many reasons, but one of them might feel like they're not accepted. And that's a very painful feeling. So they may isolate themselves more so that they don't feel that painful sense of rejection, whether it's real or just, their perception. So again, this cycle of loneliness is really very serious and pernicious, and it could really affect a young person's mental health and well-being. These on the purples on the right are kind of things that you don't want to directly say to your child or, are you lonely? But trying to get a sense along these lines of whether your child does feel connected to the people around them, or whether, they're just sort of one in a crowd and don't feel that connection. So, you want to have a sense of whether the child feels that their group of friends kind of makes them feel like they belong and that they're fulfilled by them? Or do they wish that they had other peers to confide in, people that they've trusted more, and that the people that are around them that they're spending time with are not filling the purpose of, a true friend and social connection? So focusing on young people, as we said, it is so important for healthy youth development, even more so than for adults. Young people learn from their social experiences. They are developing, their brains are developing. Everything that happens during pre-adolescence, adolescence is setting us up to be adults and to navigate the world. And social experiences are really how young people learn. And that's through mistakes, that's through conflict, it's through getting positive reward and reinforcement and feedback from people around you, and negative. And it's being able to sort of learn from those experiences. What are acceptable behaviors? What are unacceptable behaviors? When I act this way, people around me sort of retreat. They're not that interested in hanging out with me anymore. So I'm going to do that less. When I act nicely or I'm considerate, people are more interested in being around me. When I'm funny, people want to be around me. When I'm moody, they don't. So those kind of things, those little experiences really just are so full of information for a young person's development, to learn which behaviors, will make them feel more connected to others versus less. We also know that the sense of loneliness really, because of all these, critical social interactions and development, if a young person is lonely, it tends to affect them more intensely than it does even an adult. So although we hear a lot about loneliness among older people, especially the elderly population, which is definitely an issue, we do know that younger people report higher rates of loneliness than adults do, for the most part. And that is always surprising, again, because younger people are surrounded by so many more peers than older people tend to be. So I want to just, I'm not going to get too heavy into data here, but these are just some lines to take a look at. These are reports from young people about their sense of loneliness and social isolation. So on the left, it's a question saying, to what extent do you agree that a lot of times you feel lonely? And on the right, it says, I usually have a few friends around that I can get together with. So that's more of a social connection. So as you can see, the rates are pretty steady over the years, and then they start to increase on the left for loneliness and start to decrease on the right for feelings of social connection. I put the red line where the change starts to happen. And if you take a close look, you could see that that's around the year 2012, 2013. So this is a webinar and you all can't speak, but if you could think for a minute about what happened at that time or what started happening at that time, what you'll realize is that a big change that happened in young people's lives was social media and the iPhone becoming very prevalent in kids' lives. So it was around before then, but that's when Instagram really started. And kids started kind of living their lives more, using their phone, reducing a lot of their social interactions. And we do see a correlation or a relationship between that and an increase in sense of loneliness and a decrease in social connection. These are just two graphs. There are so many others that show a very similar pattern. And it's really just important to kind of keep that in mind. I'm not someone who blames everything on the phone and on social media. There's plenty of kids who found their people on social media and felt very lonely when they were in school. And, they feel much more connected, virtually through this group. So it's not the case that everybody who uses social media or all kids who are on their phone a lot feel lonely. But overall, on sort of a generation level, it is a very strong relationship that when social media and the use of iPhones among young people became so prominent, we did start seeing higher rates of reports of loneliness and lack of social connection. And then here's some more data on that, which is between 2012 and 2019. This is a study that found that over that time, 51% fewer young people said that they visited with their friends at least once a week. And what this is showing is not necessarily that kids have fewer friends, it's just the amount of time that they say that they're spending with them. personally. And then we also know that during the same time period, 2012 to 2019, not only are kids more likely to report feeling lonely and less socially connected, but we also start seeing rates of anxiety increasing as well, and depression. In this study as well, between 2012 and 2019, we see that 14% fewer young people report that they enjoy school, often or always, and a similar decline in kids finding school interesting. Again, we can speculate on why that is. As a parent of teenagers who kind of were right smack in the middle of the emergence of the phone and all that, and just were hit exactly at this time, I know, and as an adult, that the more time you spend on your phone where everything is sort of stimulating and grabbing your attention, that having to sit in a classroom and listen to a teacher in the old-fashioned way seems really boring in comparison to that. So there's a lot of things that kind of came into play with the advent of the phone and social media that kind of made real life a little bit less interesting for many kids. And this is important because we know that social connection is not just a matter of talking to your friends, but it's also being connected to your school and to your community and to what goes on in school, not just during playtime, but actually in the classroom. Now, obviously, we have to talk about COVID when we're talking about loneliness. This had a tremendous effect on the young generation who are in high school, and especially those entering college or post-high school years. We know that the young adult population, ages 18 to 25, were the most likely to be hit with feelings of loneliness as a result of COVID relative to older adults, but it had a strong effect on adolescents as well. This is not surprising to me because, you know that when kids are transitioning into early adulthood, they're leaving behind this kind of safer environment where there are all these people around them who they've known their whole lives, and they have to sort of make new friends, make a new life. And sort of the stay-at-home orders and the social isolation that came along with COVID made that very, very difficult for a lot of people. We saw rising rates of mental health problems, not just among adolescents, but even more so among early adults. On the flip side, I'll just say, and this is kind of interesting, is that for some people, they felt relatively less lonely during COVID or less anxious as well, because everybody was sort of in the same boat. So prior to COVID, if you were the only one sitting at home on a Friday night or Saturday night because you didn't have anything to do, it just was much more striking about how alone you felt. Whereas during COVID, the peak of it, where people weren't going out much, you were the same as everyone else. You weren't the oddball. So for people who kind of tended toward feeling lonely and anxious or isolated, for some of them, it actually was a little bit of an easing of that feeling during COVID because everybody was kind of experiencing something similar. Again, there's tons of variation there. You can't just kind of make a blanket statement, but it's just an interesting thing to think about. And I'll just mention one more, which is specifically about adolescents. So this is from a national survey of 8th, 10th, and 12th graders. And what this is showing is since the pandemic, changes in these feelings that are shown down below. So the extent to which kids reported feeling more anxious, more angry, more annoyed, more bored, more sad, more lonely, depressed, etc. I highlighted the word lonely, but all of these went up for young people as a result of the pandemic or following the pandemic. So what you're reading in the newspaper about kids, not doing well mentally or feeling more lonely and isolated due to COVID, we see that not just in the young adults, but we see it in the younger kids as well. So I'm going to pass it to Corey now to go over some of the risk factors for youth loneliness and what to look out for.
Yes, thanks, Linda. And so we have a kind of a whole host of risk factors that can put someone at greater risk for feeling those feelings of loneliness or being more socially isolated when compared to their peers. But one of the important ones is mental health challenges. We know, as Linda mentioned, that the Surgeon General and other public health groups have declared a national emergency in child and adolescent mental health. And we know that youth facing mental health challenges often struggle to maintain social connections and can amplify those feelings of loneliness. And then, again, talking about social media, We know that loneliness and friendlessness surged in American teens starting in 2012, which coincided pretty perfectly with the rise of social media as a kind of all-encompassing factor in our lives. It's when young people's lives moved increasingly online. And now a recent survey said that American teens spend about an average of 5 hours a day on social media platforms, which is a large chunk of time each day. And again, as Linda said, we're talking a lot about the negative aspects of social media and screen time, but we know that it's not all negative. There's a lot of positives to the internet. Our ability to connect with others from all over the world, and many people find friendship and community that wouldn't be possible in an in-person scenario based on where they live. And of course, we have things like telemedicine that have expanded access to mental health treatment for those who wouldn't have been able to access it physically. So there's lots of upsides that we want to be consistently aware of while we're talking about all of these negative aspects as well. But here are some examples of some of the downsides to social media and smartphone use and how it relates to this feeling of loneliness. We know that excessive use of social media can lead to decreased in-person interactions. We know that there's something called comparative isolation, which is this constant exposure to idealized images on social media, can highlight and exacerbate feelings of loneliness or inadequacy. You might hear they always call Instagram like the highlight reel. You're seeing the highlight reel of somebody else and comparing it to your own situation can really kind of exacerbate feeling isolated. Internet versus real life. So youth may prioritize online relationships over real life connections, which leads more to social isolation and the risk of harassment. We've talked about cyberbullying in a previous webinar, but we know that harassment and bullying are very common online. And the risk of these things increases with the more time that someone spends on social media. And these are more likely to be endured alone, unfortunately. And we wanted to talk a little bit about gaming, so video games. These are just examples of studies that have been done looking into video gaming and loneliness and social isolation in young people. And some of these studies are very interesting. Like this first one, there was a significant relationship found between students' computer game use or computer game addiction and loneliness. That might feel like a no-brainer for some people, but the second one found that students who were addicted to computer games scored lower on some of social skills than those without an addiction to computer games. And then the third one, interestingly, had kind of different findings. The results for this study showed that there was a predominantly positive influence on kind of community membership and things like friendship and social skills and social capital. So kids who were social networking and using video games socially, that it increased the size of their communities. But for some people, the online social capital increased at the expense of offline, kind of real life social capital. So just things to think about. We know that social media can be a vital tool for connection and community, especially in times of isolation, times like COVID, where we needed to connect with people online. And so if the tool's used correctly to enrich existing connections and establish new social bonds, it's proven to be beneficial. But when social technology is a way to evade having connections in real life, or someone's trying to retreat from the social discomfort of interacting with people in real life, that's when it can make someone feel very lonely. And so then it can kind of create that cycle that Linda talked about, that in-person interactions are not going well and make someone feel bad. So then they retreat, and then it kind of exacerbates that feeling of loneliness. And so we know that the percentage of teens who say that they're online almost constantly has doubled since 2015. And in another study, participants who reported using social media for more than 2 hours a day, which is most teens, as we know, had about double the odds of reporting social isolation compared to those who use social media for only half an hour. And so there are differences in interactions that we have online versus in person. And, you know, most of us know this to be true, but teens sometimes can make the argument that there's no difference. Like, my friends online are the same as my friends in person. Me hanging out with my friends in a chat room is exactly the same as if we were hanging out in person. And we know just at a biological sense that that's not the case. When you're spending time online, you're paying less attention to those around you. The depth of conversation is different. The quality of conversation is different. We know that there's large portions of the human brain that are meant for reading body language and interacting in person. And so we're not using those parts. It can reduce someone's attention span, and it can increase the boredom that someone gets with face-to-face interactions. There's this persistent sense of missing out, you know, FOMO, if you've heard of it. Online interactions are easier for conflicts or misunderstandings to escalate when you're not seeing someone eye to eye and reading their tone and their body language. Interactions online can be more impulsive and more calculated. And again, that reduced sense of belonging or feeling like you're mattering to the person that you're interacting with. And this is just another graph showing screen time and mental health. It probably comes as no surprise that young people who report more screen time report worse mental health. You'll see that 42% of students who spent 5 or more hours of screen time each day said that they have poor or very poor mental health. And suicidality, poor body image, experiencing a lot of sadness, all of these increased as screen time increased. Something else that puts young people at risk for feeling isolated are life transitions. So transitioning to a new neighborhood or moving to a new school, going from living with families to living with peers or living alone can disrupt really important supportive connections and can lead to increased loneliness. Of course, you know, moving out of the house and moving on your own and going to college or joining the workforce, it's all kind of a natural part of growing up, but it does put someone at risk for being very vulnerable. And so, you know, students in college could be struggling to fit in and feel homesick. Those not in school can feel disconnected from social groups. It's just a really kind of vulnerable and critical time to be aware. And so anyone at any point in their life can experience loneliness, but not all groups of individuals experience the factors that contribute to loneliness the same. There are groups that are exposed to greater barriers to social connection, and it's important to be aware of those that are at disproportionate risk. So things like having poor physical or mental health, being a part of an ethnic or racial minority group, being a part of LGBTQ+ organizations and groups, people living with disabilities, people who live in rural areas, just being geographically spread out from other people, people who are victims of domestic violence or other types of violence, and those who are neurodivergent. And so a little note on neurodivergence, you know, research shows that children with autism spectrum disorder, are at an increased risk of loneliness. That's because autism and other types of neurodiversity can make it harder to engage socially and create meaningful friendships at times. But fortunately, there's commonalities among neurodiverse kids who have established very close social connections. So there was a study that found that neurodiverse kids, they did best in friendships where they were accepted completely for who they are, rather than having to be expected to adhere to social norms or being hetero kind of normative in their actions. So, just there's a lot of things that put people at risk for feeling alone, but we can, if we're aware of them, then we can kind of help those that might be at greater risk. Additional age or risk factors, age, according to the Surgeon General's report, while the highest rates of social isolation were among the elderly, young adults are almost twice as likely to report feeling lonely than those who were over 65. So again, that difference between social isolation and loneliness. Even though the elderly are more likely to actually be isolated from other people, young people are much more likely to have that subjective feeling of loneliness. And financial insecurity is another big additional risk factor for kids and adults. Having less than one's peers or feeling like you have less than your peers can contribute to isolation and loneliness due to embarrassment and shame, or just not having the means to go out and socialize and do these other things. Some protective factors, things like belongingness, that's a buffer against loneliness. So a feeling of belonging to a group around you can be an important buffer against the negative effects of not feeling accepted by, a different group of peers. And that sense of belongingness can be cultivated at home through kind of family engagement, in school with peers and teachers, or also in the larger community by joining a lot of impactful group efforts. And so evidence shows that something as simple as frequent family meals can aid in child development, social and emotional skills, and resilience, and can really create some family cohesion, stability, connectedness, communication. You can imagine that, practicing social situations as a family can go a long way in helping a young person go out and do those in the larger world. So what are some warning signs that a child might be feeling lonely? And so the signs might differ depending on how old the child is. In younger children, things like creating imaginary friends, which, this is a common thing that a lot of kids do. It's not necessarily a bad thing just on its own. But it could just be one sign that a young person or a young child is having difficulty connecting to others around them. Separation anxiety with parents or siblings, excessive self-consciousness or being excessively timid. And then when it comes to older children, like teens, spending a lot of time in their room, not hanging out with friends or mentioning friends, changes in social dynamics, talking negatively about themselves, having a really poor self-image. And again, a lot of parents might look at this and be like, that just kind of sounds like all teenagers. And that might be the case, but all kids are different, and we're looking for marked changes in behavior or marked changes in what they're going through. And then, of course, mental health symptoms, so losing passion for things that they used to love, feelings of anxiety and anxiousness are all signs that a teen might be feeling really lonely. So how can parents help? For younger children, you'll see it's for both younger children and teens, reduce screen time if possible. For younger kids, help the child spend more time outside the home. You can reach out to peers' parents, so other kids their age, their parents. You can facilitate play dates and activities. You can facilitate multiple types of friends groups. So orchestrating play between those at school, those in the neighborhood, summer camps, religious institutions, extracurricular institutions. So just expanding the opportunity for social connections. You can also ask for help from school counselor or a pediatrician. When it comes to teens might be kind of embarrassed or resentful of a parent who's like stepping in and facilitating play dates or facilitating socialization. or being super involved. So the approach could look a little bit different with older kids. You can help them to brainstorm and problem solve without overstepping. But again, we advocate for trying to reduce that screen time, communicate, ask how to help, empathize with their situation, don't minimize, be dismissive, blame, or shame, help them problem solve, foster relationships with other adults. Again, facilitate multiple types of friend groups. Maybe you help them start a new team sport. You help them join a new group at school. And finally, you can connect to a therapist to help practice and develop some social skills if that's what the issue is. And again, we always talk about this when it comes to substance use, like getting down to the why. If we can understand why a kid is feeling lonely, then we can help to solve the problem. If it's inadequate social skills, it could be like, this is very common among kids who are just generally kind of immature for their age, or might have mental health or behavioral health problems. Kids might be struggling with anxiety and feel overwhelmed in social situations or in big groups. Kids who are depressed often want to stay in their rooms and doubt that others want to be with them. And so if a kid is struggling, if they're lonely because of these types of mental health challenges, we can intervene and get treatment for the mental health challenge, and then the loneliness might improve. We advocate for listening more than you talk, ask open-ended questions, help with emotion expression and naming and understanding others' emotions. We can help to adjust misinterpretations of others' reactions or behaviors. If a young person is catastrophizing, like, nobody likes me, nobody will ever likes me, we can kind of bring down that type of talk and try to help change a misinterpretation like that. Empathize, validate, role play to improve social understanding and skills. We can reinforce positive small actions, and we can practice with safe relatives, practice with siblings, practice with cousins, practice with second cousins, whoever's around. And we talk a lot about modeling. Modeling is something that parents can really do in terms of social modeling. So you can model staying in touch with your friends, your neighbors, your extended family members. You can talk about your own social relationships and discuss ways that you connect to different people. You can model asking for help or asking for support from others. You can model acceptance and conflict resolution and friendliness. You can practice and make sure that your kid sees you socialize in real life by interacting with people in real life or talking on the phone rather than just messaging somebody on Instagram, so that kids can see and hear your interactions and know what real in-person friendships are supposed to look like. And so now I know we only have a few minutes left, but I'm going to pass it back to Linda to talk about connection in schools and larger communities.
Yeah, thank you, Corey. You can go to the next slide. So a lot of what Corey just mentioned in terms of modeling and what parents can do to kind of start, all of this starts in the home, and how these interactions occur in the home, and then those get broadened into one school and community. But there's also things parents can do to ensure that their children feel connected to their schools and communities and engage in healthy behaviors. We know that that will help them academically and socially. So this is just showing that it's really important that schools are an important point of interventions, where teachers can be trained to connect parents to each other so that they can ensure that every student is, has this sort of little community within their school, their community, their neighborhood. It's important for students to feel connected to other adults in the school environment. And really, just like schools have taken on the mantle of, being anti-bullying, and, my kid's school was no place for hate, and there were all these initiatives around it, they can really both destigmatize loneliness and really help students be vigilant and supportive with their peers. So just like we teach kids to stand up, be upstanders if they're seeing someone being bullied, we can do the same for kids to kind of learn, if you're seeing that someone's sort of standing off to the side and feeling lonely, there's things that you can do, and that it's really an important, a really great value to have for children, that they don't let someone just kind of be on their own in that way, and really do stand up to kind of help kids. So not just if they're being picked on and bullied, but even if they're just seem very alone and lonely. Teaching kids to be more vigilant about that in their peers will really help, because it's the kids themselves who have to do it. We can't, go in there and force the friendships or force the social interaction, but we can instill it in our own children to be the person who steps up and is kind to the other person who is maybe experiencing loneliness, and hopefully that will help our own children as well if at a time they're the ones feeling lonely. And then there's also things we can advocate with the schools itself. Many schools do this already, but we also know that because of time and crunches for all the things that schools have to get done in a day, a lot have cut back on sort of the recreational free time, recess, etc. Those are really important times for kids to socialize, learn social skills, and just have that downtime where they could just relax and make friendships and get to know one another outside of, being watched by the teachers or being in a rigid school setting. So advocating for more free time and free play and recreational time in school is really important. If it can't happen that much during the school hours, then certainly for afterwards, for extracurricular time. But even within the classroom setting, when kids are learning, I think schools are moving more towards sort of this team work and, partnering and projects where there's groups working together. It really is important for building social skills. It certainly has its downsides, those team projects. A lot of kids don't like it for many reasons, but at least from the social side of things, it's really, really important to understand how you have to manage your relationships with others, learn to depend on other people, let people depend on you, and sort of navigate all those really complicated things that we learn as we grow up. That's really important, and that really mostly does happen in a school setting. Again, it's really important to foster adult mentorship. We know that having one adult mentor, a trusted adult, aside from a parent, is one of the most protective things that we could do for our kids, for a whole range of outcomes: substance use, mental health issues, loneliness. Having those adult mentorships are super important. And a lot of that comes from having kids participate in safe and challenging activities. It could be sports, it could be the arts, it could be team activities, it could be volunteering, civic engagement, doing things for their community where they're engaged with other kids and adults, and having to navigate all those relationships. It really builds confidence, social emotional skills, and also empathy, which is really critical for reducing loneliness as well. And I'm just going to quickly go through some of ours and others resources, and hopefully have a few minutes for questions. So the first is one you've seen many times. We kind of put this out for everything because these are critical parenting skills that really relate to everything we talk about. Noticing, starting early, talking with your kids, not being judgmental, being open, helping them navigate their situations, and getting them help if you're seeing that things are not going well. We do have resources on how to have tough conversations with kids about things, and certainly approaching a child who you think is really isolated and lonely, especially a teenager, is not an easy conversation to have because they're going to be likely defensive and feel shame from it. So there are ways of doing it that are better than others, and hopefully you can find some good tips in our resources. We do have a whole range of reports and resources on raising resilient kids where we touch on a lot of these issues of socializing and socialization. So definitely check those out. We talk often about our playbooks for parents of pre-adolescents and adolescents, which again, lots of really good tips in there. But I do want to bring up a couple of just one or two other resources outside of our organization. And I know that Compass has a bunch as well, but Common Sense Media is a great organization. If you don't know about it, it's a nonprofit that reviews and provides ratings for media and technology. And the goal is to provide information on the suitability of different, technology or media offerings for children of different ages. And they provide really good recommendations for healthy technology use in children. They do their own research. It's just a very rich, tons of information that's really useful for parents of kids of all ages. And we also really would like to draw your attention to the Child Mind Institute, which does great work on youth mental health. And they have a family resource center as well, where they do have a lot of good resources for families who are concerned about their children from a whole range of issues, but loneliness and social isolation being one of them. So it's just a good resource to know about. So I'm going to stop there. If there's any questions, I think there's one or two in the chat. And then we could provide our contact info.
So we have one hand up. I'm gonna allow Kim Iverson to, if you have a question or comment. Kim, did you have a question or did the hand go up by accident? Okay. I think maybe that was an accident. Any questions? I'm seeing nothing in the chat. I see a comment that says in my area 2012 when they started closing Fort Monmouth and lots of families left the area, causing many youth to lose friends. So yeah, so Fort Monmouth is a is an army base here in Monmouth County, locally to us, and uh, over 10 years ago they closed the base. So this person's mentioning how that led to, transition for the youth having to, leave the town or even perhaps leave the state and lose their friends and their social connections.
I have to say, I know Corey mentioned it, but it is one of the major risk factors for a whole host of problems among young kids. We know about it from substance use, but kids who move frequently, and often those are kids of military families, are really at high risk, obviously, for these issues. They form connections and then they have to move on, and it's just really, really difficult. So those are kids who really need some targeted help and special attention.
So we have another question from Joe. Says, can you help us with some guidance regarding age appropriate to give kids access to social media?
We get this question a lot. So the short answer is you have to know your own kid. The current way of thinking about it is the later the better, and the more you could delay the better. So years ago, if you were the parent who wasn't allowing your kid to have social media when they were 12 or 13 or even 14, you were considered an oddball, and why wouldn't you? And your kid's going to be a pariah. I think that things have changed quite a bit. There's more research on this, there's more talk about it. You might see it more in the media. About just how concerned parents have become and schools have become about social media and its effects on young people. We're seeing a lot out there on its effects on girls, especially when it comes to body image and depression and anxiety, and for boys as well. So I think there's more acceptance now. What we tend to say that works the best is to not have just, a flat rule and that's it. You want to know your kid. But also the best approach is if your child has a group of friends, and you could start early to talk to those friends' parents and have a bubble of sort of, let's hold off on giving social media, and so that the kid is not the only one standing out without it. If their group of friends, parents all say you could have social media when the recommendation is not before 16 now, then that makes it easier for your kid not to be the odd one out. So delay as long as possible. Don't make your kid a pariah and stand out too much from the group. If they do get social media, you can put a lot of limits on it and monitor it. That's your right as a parent, and that could be part of the agreement with the child. Kids who are more confident, comfortable, responsible could probably get it earlier than others, but these are all individual considerations. But currently the thought from the Surgeon General and from those in the field who really recommend these things, they say at least age 16 for social media is ideal, and not before that. That's hard, but you kind of want to get as close to that as possible.
Yeah, that's a great point, Linda. And I think, limiting access is huge, rather than it just be, I think most parents wouldn't give kids the car keys and just not have any expectations over when they come home and where they go. And I think phones should be similar. You expect, you give a 12-year-old a phone, and there should be some time limited constraints as to when they use them and where they're using them in the house, so that it's a little more monitored, and you can teach them some of the fluency and the literacy around using the phone and social media versus just giving it to them without any direction.
And I see another person put in the chat the mention of the book by Jonathan Haidt of The Anxious Generation, which just came out, and it's on the top of the list. it's terrific, certainly worth reading, gives a lot of very direct guidance on this, and explains why it's of such concern that kids are on their phones all the time and have the effect of social media on young people. So I think I'd recommend that as well. Yeah, this
Yeah,
is something we'll have to grapple with.
Taryn, I would love to also get him to Ocean County, so we'll get on that. Um, and I think, the presentation is timely. We had another meeting this afternoon that Corey was able to introduce the topic to, because summer is coming up, and we know that in the summer months, it could be quite lonely for a lot of students who maybe don't have access to summer camps or recreational activities. So our program in particular is trying to provide lots of free opportunities for youth in the communities where we work to try to come and participate in activities and stay socially connected to both peers and adults. Learn some skills, but also have some fun, because that is an important part of growing up, is using that muscle memory. And I think that maybe lends itself to some of those that stats you gave during the period of COVID. Um, because it's like any skill, if you just don't practice it for long enough, you do lose those skills. And adults have the benefit of practicing socialization for 20, 30, 40, 50 years. But kids only have had a few years at it before COVID happened, so they lost a lot of that muscle memory and that ability to connect, and then they developed a lot of anxiety as a result of that. So what I would say to parents on the call, and anyone on the call, is, if you're concerned that loneliness is turning into depression or a more serious mental health concern, please do reach out to our program or to any of the local providers or your pediatrician, because that we want to try to get to them early and try to prevent that from becoming a more chronic condition. So we appreciate everybody for attending tonight and being mindful of time. And do please connect with us in any way you can. There's no bad question. With summer programs coming up, we are going to be sending out a list of our menu of services that will, like I said, take place in schools and libraries and churches and all throughout the community. But if you'd like us to come out, if you have a group that you'd like us to come to present to, please do reach out. There's no cost for any of our services. And if you're having trouble getting your youth connected to services because of cost, please reach out for that as well, because we are able to help as many students as we can through our new program. So thanks for being here tonight. Thank you, Linda, Corey, for your great information. If I can share my screen back, I would like to put up our social media just so you can all stay connected to us on Twitter and Instagram and Facebook. Otherwise, have a great night, and see you next month on May 29th.